You've been breaking out around your mouth for months. You tried spot treatments, you tried changing your moisturizer, maybe you've even tried cutting out dairy and nothing works. In fact, it might even be getting worse. Here's what I need you to know. So if the rash is around your mouth or your nose and it keeps coming back, no matter what you do, it might not be acne at all. It could be something called perioral dermatitis. And if you've been treating it like acne, you may have been making it worse without realizing it. So today I'm going to tell you exactly what this condition is, what causes it, and how to actually clear it. Hi, I'm Dr. Mamina, a triple board certified dermatologist and someone who takes a root cause approach to skin health. That means we're not just going to talk about what to put on your face, we're going to talk about why this is happening in the first place. And if this is your first time here, welcome. I cover dermatology through a whole body lens, and I try to give you the kind of information you'd actually be getting sitting in my office. Please subscribe so you don't miss it. Now let's get into perioral dermatitis. So what is perioral dermatitis? Well, it's a chronic inflammatory condition that causes small red or skin-colored bumps, redness, flaking, and sometimes a burning or itching sensation almost exclusively around the mouth, periorally, and sometimes around the nose or eyes. So the other name for it is periorificial dermatitis, around your orifices. It can look a lot like acne, it can look a lot like rosacea, or it can also look like eczema, like just a full-on rash. So which is exactly why it gets misdiagnosed so often. But the pattern is very telling. It clusters right around the mouth, often sparing a small clear border right at the lip line itself. It's most common in women, usually between the ages of 20 and 45, though I do see it in men and in children. And one of the most frustrating things about it is that it can flare seemingly out of nowhere, even when you haven't changed anything in your life. So here's a critical point. Perioral dermatitis does not respond to acne treatments. In fact, many standard acne skincare ingredients actively make it worse, with a few exceptions. And there is one very specific thing that will take a moderate case and turn it severe, and I will get into that in a moment. So what are the causes and triggers of perioral dermatitis? Well, the exact cause isn't fully established, but the working understanding is this: something disrupts the delicate microbiome and barrier ecosystem around your mouth and nose, and that disruption will trigger a chronic inflammatory response. Here is every meaningful trigger of perioral dermatitis that I know of. First, topical steroids. I would say this is the number one established cause of perioral dermatitis. So if you've been using an over-the-counter hydrocortisone on this rash because it looks irritated and red, please stop immediately. Topical steroids temporarily suppress the inflammation, which feels like it's working, but the moment you stop, the rash rebounds dramatically worse. So this is called steroid-induced perioral dermatitis, and it's one of the most common presentations that I see. And the irony is painful. The more you use it, the worse it gets long-term. Next is heavy or occlusive skincare products. I'm talking rich creams, heavy moisturizers, thick overnight masks, occlusive balms that are applied near the mouth. These can create a warm, moist environment that disrupts the local microbiome. And this is one of the reasons perioral dermatitis is sometimes called a modern skincare disease. The more product we layer on, the more we can potentially disrupt the microbiome. Next is fluoride or tartar-controlled toothpaste. So fluoride is a well-known trigger, but specifically tartar-controlled toothpaste, which contain pyrophosphate compounds, are particularly problematic and often overlooked, and whitening agents are another culprit. I tell every perioral dermatitis patient to switch to a fluoride-free toothpaste as a first-line intervention. It sounds minor, but it can make a difference. Next is sodium lauryl sulfate or SLS. This is a foaming agent that's found in most conventional toothpaste and in many cleansers. It is a known irritant to mucous membranes and your skin, so check your toothpaste and your face wash. If SLS is on the label, consider swapping it out. Next is heavy makeup and occlusive lip products. So full coverage foundations and concealers around the mouth, as well as glossy or balm heavy lip products, can contribute to the same occlusion problem as heavy moisturizers. So if you're wearing heavy coverage in that area daily, that is worth examining. Next, let's talk about sunscreen formulation. We know that sunscreen is non-negotiable, but formulation does matter here. Heavy mineral sunscreens, particularly high concentrations of titanium dioxide, can be occlusive enough to aggravate perioral derm in susceptible individuals. Chemical sunscreens are generally fine and non-occlusive, but during an active flare, some chemical filters can be a little irritating on already compromised skin. So my recommendation: during a flare, choose a lightweight hybrid or mineral formula with a fluid texture, not a thick one. And once things are calm, most chemical sunscreens are tolerated well. Next, steroid nasal sprays and inhalers. So this one surprises people. Inhaled and intranasal corticosteroids like Flonase, Nasonex, and similar products, these can deposit steroid on the skin around the nose and mouth with repeated use. If you've been using one of these long-term and have a rash around your nose specifically, I would bring this up with your prescribing doctor. Then there are hormonal changes. This is broader than most people realize. Birth control is a recognized trigger, and specifically progesterone-dominant pills are more commonly implicated than estrogen-dominant formulations. And beyond birth control, postpartum hormonal shifts, perimenopause, and even significant cycle changes can all trigger perioral derm in susceptible women. The mechanism is likely a combination of immune modulation and changes to the skin's microbiome that are driven by the hormonal fluctuations. Next is thyroid dysfunction. Now, this one doesn't come up often in the literature, but I think it's worth flagging clinically. There is a modest association between thyroid dysfunction, particularly Hashimoto's thyroiditis, and various inflammatory skin conditions, likely through immune dysregulation. If you're dealing with recurrent perioral derm and it's not responding well to standard treatment, and you have other symptoms like fatigue, hair thinning, or cold intolerance, it may be worth asking your doctor to just check your thyroid. It's a simple blood test. Okay, next let's talk about diet. So diet isn't a direct cause of perioral derm the way a toothpaste ingredient is, but it can contribute through the gut skin pathway that we have already discussed. A diet that's high in processed foods, low in fiber, this can feed the dysbiosis, which can then feed systemic inflammation, which can show up on the skin. Beyond that, some patients notice a clear association with dairy, similar to what we see in acne. Dairy can stimulate inflammatory pathways in susceptible people. I don't recommend eliminating dairy for everyone, but if you're tracking your flares and dairy keeps showing up, that's something worth taking into consideration. Wearing a mask. We saw a significant uptick in perioral dermatitis in 2020. The occlusion, the heat, humidity created by wearing a mask for hours creates the ideal condition for a microbiome to be disrupted in exactly this perioral zone. What about recent illnesses? I regularly see perioral dermatitis flare after a patient has been sick, whether it's a cold, flu, a course of antibiotics for an unrelated infection. I think that any event that shifts the systemic immune landscape in your body or the microbiome can trigger it. So this is one of the reasons I didn't change anything flare happens. It wasn't a product, it was something internal. Then there's gut dysbiosis, which we already talked about briefly with diet, but emerging evidence definitely shows a gut-skin connection with perioral dermatitis, similar to what we see with rosacea and acne. An imbalanced gut microbiome, often from antibiotics, stress, low fiber, processed diet. This can drive systemic inflammation that could be manifested on the skin. Of course, this is still an area of active research, but it fits the clinical picture. Now let's talk about stress. So chronic stress can dysregulate immune function and can trigger or worsen perioral dermatitis, likely both through systemic inflammation pathways and the gut-skin axis. I mean, it's rarely the sole cause, but it's almost always a contributor in chronic cases. Next is humidity and sweating. So warm, humid climates or activities that can cause significant sweating on the face can worsen perioral dermatitis, and the mechanism's the same, moisture and heat disrupting the perioral microbiome. So let's talk about treatment. Here's exactly how I approach this condition. Step one, I strip down the routine. This is the most important and most counterintuitive step. You want to stop everything near your mouth. Heavy moisturizers, retinoids, exfoliating acids, vitamin C, anything new you've recently added. Even products you've used for years may be contributing. You want your skin in the simplest possible state. Gentle cleanser, lightweight, non-occlusive moisturizer, sunscreen, that is it. Less is genuinely more here. Step two, you want to eliminate your triggers. So go through the list I just gave you and be honest about what applies to you. The two highest yield changes for most patients is switching to a fluoride-free, SLS-free, tartar control-free toothpaste. I recommend something like Tom's of Maine Sensitive or Burt's Bees fluoride-free, and stop any topical steroid immediately. Don't taper, just stop. You may expect a brief rebound, but that will settle. Step three, some over-the-counter options that actually work. I'm a fan of azelaic acid, 10%. You can find this with the Ordinary or Paula's Choice. They make affordable solid versions. Azelaic acid is an anti-inflammatory, antimicrobial ingredient that supports your skin microbiome without being harsh. There's also the prescription strength, which is 15 to 20%. And if you want that level of efficacy without an in-person visit, you can always get a prescription through DermClick, and I will link that below. There's also sulfur-based products. Sulfur is one of the oldest and most effective topicals for perioral dermatitis. And for this condition specifically, simpler is better. First recommendation, if you want to get something over the counter, is that De La Cruz sulfur ointment. It's pure 10% sulfur. It's really cheap, widely available on Amazon. So zinc is an anti-inflammatory and barrier supporting ingredient without being problematically occlusive when used in the right formulation. So So an example that I love is the Cicaplast Balm B5 by La Roche-Posay. It contains zinc, but it also has other soothing ingredients like Centella asiatica, and it's a lightweight enough texture that it won't aggravate your skin. Then there's also squalane-based moisturizers. Squalane is skin identical, lightweight, non-occlusive, non-comedogenic. It's one of the safest moisturizing options during a perioral dermatitis flare. Brands like Biossance, The Ordinary, Timeless, they all make excellent squalane products at different price points. Next, let's talk about prescription options. Metronidazole cream or gel, that's one of the most commonly prescribed topicals for perioral dermatitis. It has antimicrobial and anti-inflammatory properties, and it works well on the microbiome component of this condition and is generally well tolerated. Ivermectin cream, aka Soolantra, so this was originally developed for rosacea, but it is very effective for perioral dermatitis. It works because of its anti-inflammatory effects. Next, we have pimecrolimus cream, aka Elidel. This is something that I prescribe often. This is a topical calcineurin inhibitor. It's an anti-inflammatory that is not a steroid. It makes it uniquely valuable for perioral dermatitis. It can calm that inflammation without causing that rebound that we see with steroids. And then I mentioned azelaic acid. You can get the 10% over the counter, but the 15 or 20% strength is available as a prescription, and that has wonderful anti-inflammatory and antimicrobial properties. I love this for patients who are also dealing with rosacea or post-inflammatory hyperpigmentation. One of my favorite prescriptions is the combination of all three of those ingredients, metronidazole, ivermectin, and azelaic acid. You can get that through DermClick. For more severe or moderate cases, oral doxycycline or minocycline can be very helpful. Just a short course of these oral antibiotics can be a useful bridge. I will often use a very low dose, like 40 milligrams of doxycycline, so that people aren't getting the antibiotic effect, but more so the anti-inflammatory effect. Step 5, this is the most important step. It's patience. This takes time. A lot of people are going to see improvements in 4 to 6 weeks. It's not going to be like immediate. If you're not improving after 6 weeks, or if this is significantly affecting your quality of life, please see a dermatologist in person. And of course, if you want help without waiting for an appointment, like I mentioned, DermClick is there. Yeah, so perioral dermatitis is frustrating because it's so commonly misunderstood by patients and sometimes by providers. So once you know what it actually is, what's triggering it, and how to approach it correctly, it is absolutely manageable. Save this video, I mean it. This is the kind of thing you'll want to come back to when you're standing in the drugstore trying to remember what I said about sulfur. And everything I mentioned, the over-the-counter products, DermClick for prescription access, and the toothpaste swap, it's linked in the description box below. If this video helped you finally put a name to what is going on with your skin, please share it. I guarantee someone in your life has been dealing with this and has no idea what it is. You might be saving them months of frustration. And a like helps us reach more people who need it. And if you haven't subscribed yet, this is the kind of content I make. Dermatology that actually explains the why, not just the what. Thank you so much for watching.